Glenn, I'm thrilled to have you on my show today. You have had such a fascinating career path from family medicine and leading major healthcare systems or health system, I would say, to how now pioneering AI-driven healthcare with Query Health. So that looks amazing for me. And by the way, thank you so much for joining me today. To just our audience, where are you joining from today?
I'm in Las Vegas area. It's sunny and blue skies.
Yeah, sunny West Coast energy then. So, how's your week been so far? I know you are juggling exciting things at Query Health. So,
Good week so far. It's busy and just trying to keep all the balls in the air, right? We're all juggling all
right,
the time.
I know. We had a chat earlier, like you have worn so many hats, like physician, teacher, CMO, and now AI entrepreneur. So, what first drew you into healthcare?
Yeah, growing up, my dad was a minister and a teacher, and my mom was a nurse. And I didn't really know engineers or lawyers or business people, but I knew doctors and nurses. So I enjoyed that, and I thought that that's sort of what smart kids did. So I ended up going to medical school, and very thankful that I chose that path because it's been a great path for me.
Great. And that's what I thought because your parents had a background in nursing and teaching. I think that might be shape your, about the care and the leadership. So that sounds awesome. So was there a defining moment earlier in your career when you realized technology could really transform how care is delivered?
Yeah, actually, and probably it was a little bit of a negative defining moment at first. Early on, I actually wrote a paper that's been fairly widely quoted. It was called,
Hmm.
if EMRs are so great, why isn't anybody using them? And this was before the government sort of forced us all to use them. And what I really saw was that they had a lot of potential, but because of the way they were being made and because of the way the UI worked, it just made practice more difficult. And so my whole career, IT has always sort of been my side gig. I've implemented Epic a number
Hmm.
of times, Cerner and other EHRs, different health systems I've been at. And my goal has always been to try to make them as useful for the clinicians as possible, which sometimes is difficult because the way
Right.
the UIs work is not always very aligned with how we actually do things as clinicians.
And you spent actually years serving in the military, in academia, and healthcare systems, right? How did those experience shape your perspective on how doctors and patient connect?
Yeah, I mean, different systems have sort of given me different things as we went along. In the military, it's a sort of closed system, and we didn't have to worry about certain things like whether people could afford their meds or could afford their lab tests. In academia, we're really focused on making sure patients stayed safe while we trained residents and medical students and making sure that our residents and medical students were good to go when they left us and went out into the big wide world. And then as a head of a medical group for a health system and then as CMO
Hmm.
for a health system, my job was then to look at the whole population and make sure we were providing high quality and we were providing good patient satisfaction and that we were providing an environment where providers and nurses and other clinicians felt safe and also felt supported and could do their
Hmm.
job. And trying to do all of that, that's a hard thing to balance sometimes, but
I know.
definitely what I tried to do.
And that is my next question. I know, like outside of work, what keeps you grounded, inspired? Because you have too many things going on. Any regular habits or routine that help you grounded or stay, I would say, creative, innovative?
Yeah, three things I think for me are one, I try to exercise every day. So, I get my walk in the
Cool.
morning, and that really sets my mindset for the rest of the day. Two, I tend to go sort of 150% all the time. And so I learned early on that I need to force myself to take time off so that that's how I rejuvenate and get my
Hmm.
batteries back full so that I can go, 150% again. I like to travel the world, so try to take some vacation time here and there to recharge. And then third, my wife is sort of the rock around which my little orbit spins. And so she keeps me grounded and makes sure that she's forcing me to eat right and exercise
Right.
and, all the things that she tries to keep me healthy. I'm not sure if I do a great job of it, but she tries.
No, that's great to hear. And you better need that for sure. It is interesting how your personal experience connect back to how you think about patient care and innovation. So let's dive into a bit. How did those early influences lead you to where you are now, like a building technology that's shaping the future healthcare?
I've always been deep into that sort of healthcare technology, and then as I've gone along, I did some things with the American Medical Association, and one of the things was we were looking at sort of what was coming down the road, and this is almost 10 years ago, and I started to learn about artificial intelligence, and as I did, I was like, wow, my colleagues don't even know anything about this. They have no idea that this is coming, and this is totally going to transform how we
Right.
provide medicine. And I didn't know how exactly because this was still early days. It was mostly machine learning. There wasn't really Gen AI yet. And then Watson came along, and I actually did a project with IBM trying to figure out how to make Watson into a sort of digital doctor. And it wasn't quite up to the challenge, but you could see that it was coming, right? I mean, like for me,
Right.
I could see around the corner and see, wow, give it 5 or 10 years, this is going to be, this technology is going to be something that really is going to change for us. And then last year, you really saw with LLMs coming into their own that, hey, this is going to rapidly change how medicine is practiced. And again, I don't know that all my colleagues really see what it
Hmm.
really is going to do, but now being deep into it and seeing what the technology can do and how good it is, you can
Right.
tell that it's going to radically change how we practice in fairly short order.
And along those lines, and I actually very much impressed that you actually wrote one of the AMA's first paper on AI. That's incredible. What convinced you that AI was going to play a defining role in medicine?
Yeah, I was on the Council on Long Range Planning and we looked at all the trends moving forward. And you could see that this was a trend that was beginning to just slowly pop up. And as I got into it and started reading more about it, I was like, wow, this is going to be a big deal. And so convinced the rest of my council that we needed to write a report on this. And so
Hmm.
worked with our staff to begin to at least give the AMA and the doctors of the AMA a lexicon to work with so that they at least understood, what is natural language processing? What is generative AI? What is
Right.
machine learning? Like at that point in time, those terms were even like a very foreign concept to all of us in healthcare. And so tried to at least give everybody a sense of, hey, this is coming. And then,
Hmm.
a lot of other people in the AMA took it from there after that first report and added a lot of really good information around it. But we at least tried to sort of ring the alarm bell that, hey, this is what's coming.
Right. I heard like you wrote that paper on AI. Is it like 10 years back, 15 years back?
Yeah, I'd have to look at the exact date. It's been a
Yeah,
while. It's
okay.
about 10 years, I think. So it was very early on in the process.
Okay. Great. Awesome. Tell us about Query Health, like in some simple terms. What does your AI doctor agent do? And what's the reason behind it?
Yeah, so my background is running medical groups for health systems and looking at how we do our work and how could we do it better. And so my goal has always been to make, providers and clinicians more efficient and more
Hmm.
effective, right? And so as I was looking at what I thought AI could do, I kept those two things in mind. And so as we started building last year, we were looking to build an AI agent that could do part of what a physician does. Because if you look at what physicians do, we're no different than plumbers or electricians or others, right? We sell our time. The way we practice medicine hasn't really changed that much for really thousands of years, right? We take a
Yeah.
history, we do a physical, we, blah, blah, blah. And so when you look at sort of that interaction between patients and physicians, how much of that could be automated by AI? And if we could automate it, we could
Hmm.
suddenly have the ability to actually scale physicians where that's really never been able to be done before, right? We were
Right.
limited by that sort of face-to-face interaction with patients. So if we could take some of what we do in a face-to-face interaction and offload it to technology, we could suddenly actually decrease the amount of face-to-face time with a patient, still make the patient feel like they've been heard because all of their information is there, and we could, change the amount of sort of productivity of a provider. And so that's what I was trying to do. And then while we were doing that, we discovered that we could also tee up for the provider as much information as possible about, hey, these are the diagnoses, these are the differential for this set of symptoms, and here is a evidence-based treatment plan based on the latest evidence, so that you don't forget things, right? Because all of us
Right.
as humans are fallible, right? We forget things.
That's
And
true.
so teeing up that information and keeping it in front of you so that you're like, oh, I would have forgotten that, but now I remember, and I should order this test to make sure it's not this one diagnosis that I would have forgotten otherwise. That's a big deal, right? It can save
Right.
number of trips that the patient comes in to see you. It can make sure that we catch diseases that are rare. As physicians, we struggle with two things, right? We struggle with rare presentations of common illnesses, right? Because
Hmm.
sometimes the disease in you didn't read the book and it comes to us in a way that isn't normal, or we struggle with common presentations of rare diseases, right? Because we're just not
Right.
used to seeing them. We're thinking, oh, well, it's probably one of these three things, but really it's four or five things down the list from there. It's one of these rare diseases. And so trying to make sure that providers always think about all of the differential when they're looking at a patient rather than just getting stuck on the first two things that come to their mind. And then that they get the latest, greatest from a treatment perspective. Because
Right.
again, medical information is doubling every 2 to 3 months. And so
Right.
nobody can keep up with that, right? And so we want to make
That's
sure
true.
that everybody is as up to date as possible.
I would say like a healthcare system, it's such a huge ecosystem where it's not just only to do a lot of things on AI, but we can help through AI, we can help a lot of physicians and the patients, and make their life easy. So I agree with that.
Correct. There's a
And
lot of administrative pieces that need to be taken over and done by AI, and those are already, there's a lot of companies in those space.
mhm,
There's not a lot of companies that have actually tried to attack the actual clinical space. And so we decided, and again, my background and my two partners, their backgrounds were all physicians, and we decided we wanted to be actually in that clinical space and attacking that clinical workflow rather than just the administrative workflow that so many other people are trying to deal
right.
with.
I heard that means you help implement Epic multiple times. That's not, I would say, the small feat. Means what lesson? Because Epic is one of the, I think, the best tools for now, I would say, in the healthcare, and biggest, I would say.
It's
So,
certainly the biggest.
and so I know you have, it means you have awesome background on that. So what lesson did those experience teach you about the relationship between physician or clinician and technology? Is there, anything that you want to share the experience?
Yeah, I think the biggest thing I would say there is I learned that anytime you're changing workflows,
Hmm.
in medicine, it's hard because we're all very conservative by nature and we're all used to doing certain things. And so if you want to
Right.
change that, it's very difficult. And so, yeah, I would say that's the biggest thing that I learned doing all of those big epic implementations and Cerner implementations is change is hard in medicine.
Changes and art. Right, right. But nowadays, it's like kind of have some awareness, and the youth, the young generation now kind of adopting those changes. But it's again, it is hard though you have been living at the intersection, like innovation, technology, and implementation, right? So that's never a simple, I would say, in healthcare, because one of the thing that you just mentioned, adoption, change, right? So I would love to zoom out a bit and talk about a state of innovation today. Your vantage point, right? What's changed the most in the last 5 years about how healthcare system approaching or adopting AI or digital innovations?
Yeah, I think health systems were pretty stuck in their ways up until the pandemic. I think the pandemic really changed healthcare innovation for good because it showed that certain things that I mean, for example, I had been trying to do virtual visits and had been doing them. We were on the bleeding
Hmm.
edge of that almost 15 years ago. But honestly, it was very difficult and payment systems didn't work right and all that stuff. And so then suddenly when we had to do it, then people could really see the value, right? And so
Right.
now the interesting thing is much of that has slipped back into the old pattern because, again, partly because of the way things are paid for, right? It's much more difficult to get paid for things in the virtual environment than it is if you bring the patient in and sit their butt in your office, right? Like
Exactly.
that's you're always going to get paid for that. You may or may not get paid for some of the other things. And so the payment system that we have in this country stands in the way of innovation a lot of the time. And so that's why you see so many of the innovative companies, they only take cash for what they're doing because, just
Hmm.
the insurance companies and the government get in the way of innovation because of the way they want to pay for things. The payment systems have not kept up. There's not been innovation in payment, in a way that supports all the innovations that we're doing out there.
When you are bringing something like query health into real world clinical settings, what tends to be biggest adjustment for teams, whether it would be a tech itself, workflow, or even mindset?
I think it's mostly mindset, to be honest, and in two ways. And I'll give so one, there's been much more fear from clinicians than I expected. Fear of
Hmm.
losing their job, fear that AI is going to take over their whole job. And I don't think that's a realistic fear. Maybe in
Right.
50 years it is, but in the short run, it's definitely not. And the reason is we're so short of providers right now in almost any specialty you want to name, and certainly in primary care, which is my world. And so, but it is still that fear is paralyzing to many of them. They're like, well, I don't know if I want
Right.
to, go down this path because it might put me out of a job someday. And it's like, but it probably is more likely that if you don't go down this path, you're going to become the dinosaur that ultimately gets put out of a job because you're not using the best tools. So that's been number one. And then number two, I think to me is everybody's running so fast. They're trying, just to sort of stay even. They have to run faster and faster, call it the hamster wheel. And so
Hmm.
they're going so fast that nobody wants to take the 2 weeks of time to redesign their workflows in a way that would make them more money, that would make their lives easier. They just can't divorce themselves from the process for the time it takes to actually do that sort of redo of their workflows. And that
Hmm.
right now is holding everybody back. And so, because eventually, sort of like we said with EHRs for a long time, right? Is we
Right.
shouldn't just be computerizing the things we're already doing. EHRs can do other things in a way that's
Hmm.
different than how we did things on paper. And it took a very long time for us to sort of get through that sort of change management. And likewise, I think here with AI, we need physicians and other clinicians to really look at it and say, you know what? We could completely change the entire workflow of how we do things using AI. And I don't mean just ambient scribes, I mean other AI processes. We could actually make it more efficient for patients, more efficient for providers, but people don't want to take the time it takes to actually revamp that, and they're scared to do that because they're scared they're going to lose out in some way. So those are
Right.
the two big things from my point of view.
And I completely 100% agree with that. Let's talk about like a goal or like your wish. Looking ahead a year or two or five, what outcomes or the milestone would you make you feel like Query Health is truly moving the needle? What would the success look like in your eyes?
I think the real success would be if we've changed the economics of medicine enough that that
Hmm.
looming, shortage of 100+ thousand providers by 2037, that's the estimate,
Hmm.
if that was no longer a thing, right? Because we've actually changed the throughput such that access to providers is no longer a problem because the AI
Right.
is helping us in a way. It's allowing us to do more for more people. It's allowing patients to feel like they can easily get their questions answered. If we do that, that will be success from my point of view. I will feel like we have really made a difference because ultimately,
Hmm.
what I care most about is patient care and about creating better care for patients and doing it in
Right.
a better way that makes their experience better. And so, if we can do that, I'll have felt like we have met our goal of bringing, AI enhanced medicine to the world.
I wish for the best, like to achieve that goal. Ultimately, it helps to, overall society. And this is one of the great question that if you could have a magic wand and remove one barrier, one bottleneck, regularly uncertainty, funding cycles, adoption speed, or some kind of changing a mindset, which would unlock the most impact?
That's a great question. I think it would be the adoption cycle, to be
Hmm.
honest. I think the adoption cycles in healthcare are so ridiculously long, and the sales cycles are so ridiculously long that it really makes
Right.
it difficult to bring, AI is advancing so quickly that I still fear that healthcare is going to be left behind a little bit because we just can't do things quickly enough.
Do you see like a clinical trials or FDA approvals would be a bottleneck, or is it something a part of a process?
I think regulation has the chance to be a bottleneck. I think right now the FDA doesn't really know how they're going to deal with Gen AI, and so they're kind of allowing a little bit of leeway. So we'll see. I mean, for sure, if you look at Europe, they have created such a bottleneck of rules that nobody is going to be using AI in Europe until the very last, right? They're going to come
Right.
last because of the rules that they've created. And so so definitely depending how things go, I think this administration seems likely to take a fairly light touch on the administrative, regulation side. But,
Hmm.
if we get too much regulation, we need enough to keep people safe, but we need it to be, as little as possible to allow as much innovation as possible.
Awesome. So you have seen healthcare from, I would say, like every corner, every side, clinical, operational, and now technological. So as we wrap, I would love to leave listener with a bit of wisdom. So to that, along those lines, my question is like, what excites you most about future of AI in healthcare? Where do you think it will take our biggest difference first?
What excites me most about AI in healthcare is I think it has the potential, and we'll see how it plays out, but it has the potential to truly democratize the way healthcare gets applied, especially medicine gets applied to patients, regardless of your ability to pay, regardless of
Hmm.
geography, not even here in just in the United States, but across the world. There are so many people who lack good access to even primary care across the world. And even here in the
Hmm.
US, I mean, if you're in the wrong geography or if you're in the wrong sort of minority, you may or may not have good access. And I think AI has the potential to unlock that because you can access that information highly tailored to you, by the way, because what we do is we pull down all your information and we tailor
Hmm.
everything we do to your specific case. So, giving you that ability, regardless of where you live, regardless of, how much money you make, I think that has the potential to really level the playing field for everybody in this country so they get the best information and can make the best decisions about their health and about their health care.
If you could give a message to young entrepreneurs or young physicians entering in this space, what piece of advice you would like to give them?
I'll say to young clinicians, I would just say, don't be scared of what's coming,
Hmm.
embrace it. Change has happened throughout all of history. And, medicine is no different. We need to embrace the new technology and use it to do what we all came into medicine to do, which is to help people in the best way possible. And so embrace the technology, use it to your advantage, use it to the advantage of your patients, because change is inevitable and AI is here to stay. And
Right.
so you're going to have to learn how to use it. So learn how to use it well.
Awesome. Glenn, this has been such a fascinating conversation. And thank you so much for sharing your journey, your insights with us. The way you are blending like clinical wisdom and AI innovation is exactly the kind of progress we need in healthcare today. For the listener, where we can connect with you or learn more about your innovation or about Query Health, where they can find those details.
Yeah, you can either connect with me on LinkedIn. I'm just Glenn Loomis, MD, GLENNLOOMIS, MD. Or you can look us up at our website, which is queryhealth.ai, QUERY health.ai. I think .com was taken already or something. I don't remember why we're
Okay.
.ai. But yeah, so we would love to connect with all of you. If any of you want to try our product in your practice, get on and I'm happy to work with you on that.
Awesome, Glenn. I really appreciate how you described, the everything and provide insightful, such amazing. So thank you so much again.
Thank you, Drew Paul. Thanks for the
And
opportunity, and I appreciate it.
yeah, signing off now.